For biopsy recommendation, abnormalities on a mammogram sometimes require further testing. If you need additional tests, a certified nurse navigator will be by your side with the education, insight, advice, and support you need.
Linda, we're going to take you down to talk to Dr. Hollenbeck, our radiologist. He's in this office right over here. He's going to go over your images with you. Okay. I'm sorry that you had to be called back, but hopefully he'll explain everything to you.
Okay, thank you.
You're welcome. This is Dr. Hollenbeck.
Hello, Linda. How are you?
Nice to meet you.
Please come in, have a seat. Just like to review your mammogram with you.
Okay.
What I see here is these bright spots within the breast. This is the left breast, this is the right breast. And right here you can see a small collection of bright spots, which is actually calcium. Mm-hmm. Now, calcium is found in the breasts very frequently, and the vast majority of the time, it's actually completely benign and nothing to worry about. Mm-hmm. But occasionally, I see calcium that looks a little suspicious. And for that reason, I'd actually like to do a biopsy. Now, what I will tell you is when I see calcium like this, there's the potential that it could actually be the earliest form of cancer called DCIS. The good thing is that this is completely non-invasive, and this is why we do screening, to catch cancer this early. Mm-hmm. Almost 100% of women with this diagnosis, almost 100% survive, okay? So the best way to biopsy this is to actually have a stereotactic core biopsy.
Is that going to hurt?
Now, it sounds like a big thing, I understand, but we actually do it here. Mm-hmm. We all work together, we make you extremely comfortable, and we actually use X-ray to triangulate and target these calcifications. Mm-hmm. The needle will go in, remove that tissue. We'll actually take an X-ray of the tissue to show that the calcifications are there, mm-hmm. and then we'll discover what's happening here.
Is it going to hurt?
There's a bit of pain initially as I give you the lidocaine, and after that, I'll give you so much lidocaine that it shouldn't hurt at all.
So do you think this is cancer?
Well, when I look at a mammogram, actually what I try to do is categorize the finding from being completely normal mm-hmm. to being definitely cancer, okay?
Is this down here?
Exactly. Now, where this is in between the middle portion, which is probably benign, mm-hmm. and suspicious. So I would say, looking at this, there's probably 20 to 40% chance that this is the earliest form of cancer.
Okay.
So we don't know. I'd like to be able to look at this and say that there's nothing to worry about, but the fact is I can't. So we really need to do this biopsy to find out.
Okay. When can we do that biopsy?
Well, what I'll have you do is actually talk to our nurse coordinator, Linda, and she will discuss the procedure more in depth with you, and we'll schedule it very soon.
Okay. And will you do the procedure?
I will.
Okay.
Okay. Let's come
Okay.
right in here,
Okay.
Linda, and have a seat. So, a lot to take in. Yeah. What I want to do is answer any questions you have about the biopsy. We can schedule that. If you want to, if you've got your calendar with you, we can do that today. If you want to call me, I've got a card I can give you. And so we can take care of that right now so we can keep things moving for you. And my role is to make sure that you get your results in a timely manner. If you need any referrals, all that happens very quickly. But the most likely thing is that this is going to turn out to be not cancer, to be benign. And so that's what we're going to find out.
We have to do the biopsy in order for them to determine that it is benign.
Right. Dr. Hollenbeck can't tell from looking at those pictures whether it's benign or not. He's a little bit suspicious, but he feels that the likelihood is that it's benign, but we don't know for sure until we get that little piece of tissue, which will be a mostly painless process, and then we send it off to the pathologist.
And then what happens if it is cancer?
Well, if it is cancer, we get you hooked up with our cancer center, which has top-notch, best docs around, and we do it in a timely manner, and so that you're not waiting around, and you get the best care available. And so, you want to take a look at your schedule?
Okay, yeah,
I've got a list of some dates that are available.
okay.